with the border around it. I've seen the border in our version as well. I think it's meant to be
Yeah.
there.
Nope, it goes full screen, so that's just the front screen.
Yes.
Okay, just checking.
Thank you so much. We appreciate you. Okay. On the rural health transformation, that's what I'm presenting on. So what was the name of that community and TIF that you did the ribbon cutting for?
Um, Magnolia,
Magnolia. And it was a housing community for seniors, is that right?
Magnolia Villas,
I said I had to.
And it was a housing community,
affordable
affordable housing for
for
all
seniors.
ages. That's what I thought. And you said Magnolia.
I don't even have a paper. Jamie does. Jamie's very good.
Villas. No,
I
Villas.
appreciate her having a
Villas.
paper.
Villas. Okay.
The what is the week?
That's the Volunteer America was a million.
Okay, that we contributed to the
Right.
volunteers.
Right.
Okay, gotcha. Volunteers of America. And then the Farm Bureau.
That's the only person that's in town.
100K.
100K.
There is. I mean, that's exciting.
And that was to support the farmers, Georgia farmers.
Because we see healthcare in a holistic view, not just paying
that.
claims.
She's right before me time.
Wonderful.
So when I come down. Okay. All right, I got it. So you coming down with me.
It's going to be a greater audience than this.
When I was walking in, there was a lot of people walking out.
Yeah.
And then I've heard some people say, "Well, I'm leaving because I don't need. I
Folks are
already got my health partner, so I already talk to you guys regularly, so I don't need to stay."
Yeah.
I heard that just a couple times.
Right.
I'm like, okay.
A lot of folks are trying to beat that traffic.
Oh yeah, they try to because I'm right with them.
Yeah.
I'm right with them. Stop playing.
Muted.
Okay.
You'll hear. It's on. No, it's on.
Kind of wish it was a larger crowd.
They might trickle a little. I mean, I was looking at like the end, excuse me, about America, and it got. I think the end of the day was a little harder too, because everybody's trying to get out of the traffic and things. So, but people will trickle in, hopefully. But we're also against the billing, like the other people that are presenting as claim denials and billing. So I don't know if they're going to be on time. Ty's here. I didn't see her right there next to me. So as soon as you left, I was like, wait. Delete that. She was.
We ready? Are we ready? Good afternoon. Wow. When I first arrived earlier today, it was about 200 people in this forum. And now it looks like everyone is sitting in Delta comfort. Okay, we're gonna roll with that. Good afternoon, everyone. I'm Dwayne Flowers. I'm the COO and the Vice President of Market Operation for CareSource. It's an honor to join you today. CareSource has a strong and growing presence in Georgia. We entered this market in 2017. At the time, we were the fourth CMO. As you know, Peach State acquired WellCare, and we trimmed down to 3. CareSource still remains fully committed as a stable, mission-driven partner to DCH and the provider community. Although we serve more than 2 million members across 14 states, our Georgia work is deeply local, relationship-focused, and aligned with the needs of the state Medicaid population. Our mission is clear: to make a lasting difference in our members' lives by improving their health and well-being. What set CareSource apart is a combination of a heart-centered mission and the operation rigors required in a fast-changing Medicaid environment. Emphasis on fast. We know Georgia. We understand its unique needs: urban, rural, behavioral health, maternal, and the social factors shaping members' outcome. And we are prepared for the next chapter of Georgia Medicaid. Since going live in the state, we work closely with providers across Georgia to increase access, streamline care management, improve quality performance, and reduce administrative friction. That work continues as federal and state policy evolves, and as we navigate changes such as the One Big Beautiful Bill. I'm joined today by several CareSource leaders and colleagues, and we will walk you through their areas of expertise, including SDOH, quality care management, behavioral health. Each of them play a critical role in supporting you improving outcomes for the population that we jointly serve. CareSource is not just operating in Georgia, we are invested in Georgia. Invested in a stronger partnership, better health outcomes, and a more resilient Medicaid system for the future. Thank you for the work you do, and thank you for partnering with us to serve Georgia members and community. All right, next we're going to talk about social determinant of health.
Good afternoon, everyone. My name is Brandy Yarbrough, and I am the Life Services Manager for CareSource Georgia. Before I get started, I do want to say that we would like to hold all questions until the end of the presentation. We have a lot of folks that are going to be presenting here today, so we want to make sure we're able to get through the entire presentation. So during my portion of the presentation, I will be highlighting key factors of SDOH, or social determinants of health, trends in member assistance, and our strategies for addressing member needs. So as we all know, social determinants of health are health-related social needs that are found where people live, learn, work, and socialize, and they impact health outcomes. Some key factors include economic stability, which include employment status, income level, and financial resources. These affect access to health care and services and medications for our members. We also have education access and quality. Educational attainment and literacy levels influence health literacy and understanding of health information. And then third, we have our healthcare access and quality, which are availability of healthcare services, insurance coverage, and transportation. These all impact the timely access to preventative and necessary medical care for members. Additional factors include neighborhood and built environment, which includes quality of housing, access to nutritious food and safe environments. These all affect physical and mental well-being, leading to health disparities for individuals. And then we have social and community context, which are social support networks, community engagement, and experiences of discrimination. These all influence the mental health and overall resilience of individuals. So some of the SUH trends that we have specifically been noticing within our life services program include, well, obviously an increase in social determinants of health, barriers amongst our members, and what we have noticed from 2024 compared to 2025 is that there has been a significant increase in the number of referrals that we have received, and I will get into in a later slide into how we actually receive those referrals. But on average, in 2024, we received about 182 referrals per month compared to 267 per month this year alone in 2025. And this is data just through September of 2025. In 2024, we assisted about 2,178 members to date. Well, through September of 2025, we have assisted 2,401. We can attribute this, to definitely increasing needs, right? Social determinants of health barriers amongst our members, but also awareness of our life services program and the connecting members to resources in their communities. We've also noticed that our SEOH barriers have been trending higher. Here are some specific examples. Housing in 2024, we did 633 resource connections for our members compared to 980 just through September. Utility and rental assistance, 226 compared to 974 in 2025. Food, 210 compared to 562 for food access barriers. Transportation, 138 compared to 355. And then child care, 108 compared to 414 for 2025. So what are the effects that SCOH barriers have on healthcare? Well, we all know that there are health disparities. They contribute to unequal access to care, poorer health outcomes amongst marginalized populations. Also, individuals that are facing socioeconomic challenges are at a higher risk for chronic diseases due to limited access to resources and care. And then there is also a lack of access to education and healthcare services, which can lead to missed preventative care opportunities, resulting in more severe health issues. So it's important that we address these SUH barriers in order to improve the health equity and outcomes for our members. And by understanding and intervening in these social factors, we can better support our members in achieving optimal health and well-being. So as our SUH screening process includes a comprehensive assessment. So upon enrollment, members undergo an HRA, or health risk assessment, that includes questions about social determinants of health to help identify what their specific needs are. We also use validated screening tools like the PREPARE assessment to ensure consistency in identifying those barriers that are related to healthcare access, housing, food insecurities, transportation, etc. We screen our members upon intake and then periodically through their treatment journey, which could be every 6 months or annually. And then we use a tailored screening method to accommodate diverse populations and ensuring accessibility for all members. And then some key components also include cultural competency training for our staff to ensure sensitivity and understanding during the screening process for our members, as well as multilingual resources to support members and their language barriers. We also have staff on hand that are bilingual in English and Spanish for our Spanish-speaking members. So as it relates to life services, our member journey, there is no wrong door approach to members being a part of the Life Services program. They can be connected through case managers, through providers, through partners, community-based organizations, and members can also self-refer. We conduct, like I mentioned previously, a health needs assessment just to assess the members' resources, skills, talents, and wishes for long-term employment, or to also identify any SDOH barriers they may have. And then they work with a life coach to set goals. Members, receive ongoing supportive services from their life coach, and they can be enrolled in the program for up to 24 months. And then as far as screening roles and responsibilities, we do have some providers that conduct SDOH screenings as well during their health assessments, and they are able to refer members to appropriate resources or refer them directly to Life Services if they have any identified SDOH barriers. Also with our life coaches and case managers, our teams follow up with the members post-screening to assess any ongoing needs, and they coordinate resources and interventions based on any SDOH findings. Then they continue to engage with the member to provide education and available resources, and then they assist with referrals and follow up on resource utilization. Typically, they have ongoing contact with our members, either on a monthly basis or sometimes on a semi-monthly basis to ensure that the member's on track to either meeting their goals or addressing whatever their SDOH barrier is. And then also through collaboration, we have regular team meetings amongst our different care coordinator, care management teams, life services, member services, so that we can discuss any member needs and resource allocations. And then we also utilize Guiding Care, which is a care management platform to ensure that our team members are aware of each other's members' SDOH status. As I mentioned previously, assessment tools we have are Prepare, the HRAs, and then internal screening tools. And then we have a referral system in place where we are able to refer members to different partnerships that we have in different communities with local agencies for housing, food, security, workforce, and transportation. Then we also have an integrated referral platform to track and manage those referrals. SDOH data is stored in electronic health records and then tracked through case management systems. And then we also have monthly and quarterly reports that are generated to analyze any SDOH trends, needs, and outcomes. And then more data management. So data is used to identify any gaps in services and inform program improvements. Outcomes are monitored to assess the effectiveness of interventions on the member's health, and this includes quarterly HEDIS analysis comparisons. Basically what that is we compare members that are participating in our life services program to the overall CareSource population to see if there is a difference in them meeting those HEDIS measures. And we have found consistently that there are improved outcomes as it relates to HEDIS. All referrals are documented and assigned to responsible team members within our Guiding Care platform. Then we also use Find Help, which is a comprehensive resource platform which is access to refer members to essential services within their respective communities. And this allows our team members to connect our members to social services and community resources. Then we also follow up with calls that are made within 2 weeks to ensure that members receive the resources, and then we have a closed loop referral platform, which is the Find Help integration into Guiding Care. And that is all I have. Next we have Jamie Schwartz with Provider Complaints.
Good afternoon. My name is Jamie Schwartz. I'm the Senior Manager of Provider Performance. While we hope you never have to reach out to us with a complaint, we do understand that sometimes they occur, and we want to provide you with education on end-to-end workflow from intake to resolution phases if you do have a complaint. We have various channels for this process. You can either connect with your health partner, or we have a Georgia Provider Relations mailbox, which is monitored by one health partner. Whether you reach out to your health partner or email the relations inbox, the health partner will acknowledge receipt of your complaint within 2 business days, and then the review process begins. Once the initial review is completed, they assign the concern to the applicable team or teams. The assigned health partner may reach out to you for more information if needed, and a more detailed investigation will be performed. You can see the timeline across the process here. During the analysis process, root causes are identified and resolutions are created. Reports are run if needed, and we implement any solutions created. At this time, the provider is contacted with findings and resolutions, such as refiling claims, contacting GAMIS for provider credentials, etc., after which the complaint is resolved. There is a lot on the slide, so I won't bore you with reading the whole thing, but what we did do is identify the top 3 provider complaint trends, as well as lessons learned and action plans to ensure these are resolved. Of note, we do have network notifications posted on our website to let providers know what to do when a provider, for example, is not associated with a group or a provider address is not matching the 7400 file. As a reminder, please complete all updates through GAMIS. I will invite Brittany up to help me discuss Georgia Pathways.
Hello, everyone. The first thing that we will discuss is retroactive eligibility for Georgia Pathways members. In this example, you will see that the member applied for Georgia Pathways on January 15th, and when Georgia Pathways eligibility is retroactive, the coverage will begin effective on the first date of the month in which they applied. New members are retroactively covered through fee-for-service, and members will transition to coverage under their CMO 2 days following their eligibility determination. As you can see on the timeline, the member applied for Georgia Pathways on January 15th. The application went to review. Eligibility was determined on March 5th, and they were retroactively covered for January 1st. We don't provide any assistance in prior months' medical bills for individuals enrolling in Pathways. The next thing we'll discuss is Pathways copays. When Pathways was implemented, there were no copays. However, effective on October 1st of 2025, Pathways did begin applying copays. There is a chart for your reference with each Pathways copay, and you will notice that the copays are very similar to Georgia Families and Peach Care for Kids copays. Pathways members under the age of 21 are excluded from copayments, and the members who cannot pay their copayments cannot be denied care for covered services. Jamie?
The next 4 slides will clarify provider responsibilities with Georgia Pathways and give resources for any further questions you may have. We want to ensure providers focus on member access as well as staff education. For member access, please confirm that there are available appointments for Pathways members, that the member's contact information is up to date, after hours access is available and clear instructions are provided, and language assistance is available as needed. In addition, please ensure that you are monitoring appointment scheduling for open slots, documenting all member information and interaction, reporting any access barriers that you may come across, and communicating to administrators if there are any issues or concerns. In regards to staff education, please provide orientation for Georgia Pathways as a part of your program requirements. Continue to train on any updates if they occur, that your staff understands member access procedures and distributes any relevant educational materials. This last Georgia Pathways slide contains resources that we think may be beneficial for any providers participating in Georgia Pathways. There are live links that bring you right to these resources. They are also found on our website. Next will be prepayment review.
Good afternoon. My name is Ty Bracken. I am the Program Integrity Manager for Georgia. I'd like to review with you our end-to-end process for prepayment review. So CareSource adheres to the Department of Community Health Policy and Procedures for the Medicaid Peach Care for Kids manual regarding prepayment review. Prepayment review is defined as the review of a provider's medical documentation prior to the payment of a claim. A provider may be placed on prepayment review for several reasons that may include violation of Medicaid policy or conditions of participation, inappropriate or aberrant billing practices, credible allegations of fraud. Decisions regarding prepay review are made on a case-by-case basis after thorough evaluation. Discretion will be applied to determine whether specific CPT codes or all CPT codes will be placed on prepayment review. Once a decision is made to place a provider on prepayment review, a written notification will be sent to the provider within 30 calendar days of the start date. In some situations, it may be necessary to implement prepayment review immediately. In this case, providers will be notified after the action has been taken. During the prepayment review process, CareSource evaluates the provider's documentation to determine the appropriateness of claims for Medicaid payment based on regulatory guidance. Examples of prepayment review results are services billed that are not supported by established policies, prior authorization not obtained, improper licensure for providers. Prepayment review provider disputes. Providers cannot appeal CareSource's decision to place them on prepayment review based on OIG guidelines. Providers may appeal denials of any claims. With the OIG and CMO coordination, OIG will review the CMO prepayment review findings and determine if similar actions should be taken for claims billed for the fee-for-service program and other CMOs. So let's discuss the prepayment removal process. Providers must demonstrate timely and accurate claims billing during this period. Providers who do not demonstrate timeliness and accuracy in claims billing may be terminated. Performance requirements for prepayment review removal are the provider must bill 10%, more than 10% of normal billing volume. You must have an audit pass rate of 85% for 3 months within that period. Providers achieving an error rate of less than 15% must sustain that error rate for a minimum of, less than 15% that must be sustained for 3 months. It does not have to be 3 consecutive months, but 3 months within the review period have to be above a 15% error rate. Below, apologies. Providers will be notified in writing of the effective date of removal once that point has been met. And ongoing monitoring of billing behaviors will occur, and if any aberrant billing behaviors are identified, the provider may be placed back on prepayment review. There is also a period after the prepayment review has ended that we may do a post-pay review just to confirm that those billing behaviors initially found have been corrected. So our end-to-end process is the prepayment review initiation. It is the notification, the medical review period, monitoring, and then removal. Additional process information include monthly performance summaries can be requested from the providers. You would outreach to our provider, our prepayment review email box, which I will have listed on the slide, and you can request monthly a summary be provided to you so that you can see what areas you may need to address for your billing to be corrected and claims to be paid appropriately and timely. At any time during the prepayment review process, CareSource will meet with the provider to answer any questions, and audits are completed within 30 days of the receipt of medical records. Those outreach from you to us would also include if you're having any technical difficulties with the provider portal. And so going into that provider portal, we accept records for prepayment review only through our provider portal. The notification letter that you receive, if you are placed on prepayment review, will have detailed instructions on how to utilize that portal and how to upload your records. You would just follow the steps, and if you run into any obstacles logging into the portal, please outreach to your health partner. If you experience any technical difficulties loading the documents to the portal, outreach to the points of contact in the last slide, and we will be able to assist you. This is an example of our prepayment review notification letter. I'd like to share some of our prepayment review performance metrics. The total value of cost avoidance savings during the period of Q1 and Q2 of 2025 totaled $1,228,026. That amount includes, the cost avoidance calculation includes paid amount of claims for which medical records did not support the charges billed, claims for which records were requested on prepayment review and no records were received, and it also includes a change in billing behaviors based on the education provided. I'm sharing now a slide of the points of contact for prepayment review. If you have any questions, any concerns, you can outreach to the prepay email box, which is prepayreview@caresource.com. You can also outreach to SIU email box, which is fwainquiries@caresource.com. And also we have our CareSource Health Partners engagement map posted. Next up will be Allison Sweeney to discuss autism spectrum disorder support.
Hello, good afternoon, everyone. Allison Sweeney, I'm a behavioral health program manager with CareSource on the behavioral health team for about 6 years now. I'm gonna just take a couple minutes at a high level to talk a little bit about autism spectrum disorder in the support system and some wins we've had navigating this difficult system of care. So we want to take a look at this in a couple main points for this framework. Many of you are probably familiar with care coordination, right? That is a collaborative and comprehensive process that really supports a member, an individual, and their family in the unique needs that they have. It encompasses a lot of different components, but at a high level, we're looking at interdisciplinary treatment planning and team meeting, navigating resources, education about resources, and I think an often overlooked but important part is the monitoring and follow-up to make sure that once treatment plans are in place that they're getting what they need and we're helping them address barriers. A family-centered model is incredibly important in all types of healthcare, and specifically when you get into behavioral health, and especially with autism spectrum disorder, it really affects the entire ecosystem of the family. So a lot of the interventions for someone who is on the spectrum involve behavior, right? Behavior modification that needs to be reinforced over time to make a lasting difference. So we find that outcomes are improved when the family or caregiver is involved and empowered, as they can reinforce those interventions in multiple settings, which really leads to better outcomes over time. If you look at it from a payer and really system of care perspective, provider perspective, you can be looking at reduced cost over time. You have less emergent admissions, you have earlier intervention because things are getting caught and addressed earlier. So overall, good for everyone. And then, of course, as always, we're focused on ensuring that members have fair and equitable access to services, resources, and support. We understand everyone has their own challenges and strengths, and we want to address those for the individual and their family. Access and availability is incredibly important for all medical care. When you talk about diagnoses such as autism spectrum disorder that really have a neurological component and can change over time, it's incredibly important to get early intervention, and that is also associated with long-term outcomes. So I'm going to provide two very high-level case studies that we feel are successes in navigating these complex cases. Just a caveat that we've changed PHI, protected health information, demographics to protect the confidentiality of the member. And so obviously these are two people we're speaking about who have very in-depth lives, and I'm going to just quickly give a high-level summary to illustrate. So the first one we're speaking here is a child. So this is an adolescent age male, had a complex clinical presentation, including a primary diagnosis of autism spectrum disorder, but also depression, anxiety, and seizure disorder. Additionally, there were some barriers to treatment in that there were some behaviors that created difficulty with placement, and that includes history of aggression towards caregivers and some sexualized behavior. What was interesting in particular about this case, with really a focus on a family-centered and equity approach, is that we really had to value the caregiver's choice in this instance. So the guardian was the aunt of this member, and declined a lot of referrals that were given. So we had the wonderful support of working with DCH, DBHCD, the multi-agency treatment team to offer a variety of things such as in-home intensive services, peer support, ABA, and the guardian did decline these services. So I think it's an example of kind of meeting the family where they are. They were clinical recommendations, but we also want to work with the family to ensure they get what they need, such as psychoeducation and kind of monitoring how they can perform at that level. So we were able to connect this child with outpatient psychiatry and therapy services. The member is connected with a terrific CareSource care manager and is in the process of appealing a comp waiver application and will continue to monitor. And so lastly, we do have a case that is, they are an adult now. They came to us when they were in their teens. This is a young adult of transition age. And at the time that she came onto CareSource, she was actually in residential treatment in another state for several years. Kind of more of a severe case, primary autism spectrum, nonverbal, also had bipolar disorder, and some behavioral issues in the treatment setting that became barriers. So we were up against the 18th birthday coming up for this individual, which posed some additional placement issues, ensuring there were the right access to care. We were able to be supported by DCH, DBHCD, the multi-agency treatment plan, and our team worked incredibly hard, our behavioral health and care management team. I think there were about 12 to 14 providers in the state of Georgia. We attempted repeatedly to get this individual care. There was a time when she went off of coverage from CareSource, but we maintained contact with the family during that time, and we were successful in placing the member, transporting them, actually helped facilitate. They were picked up from the airport when they landed, taken to a facility, and the member has been improving and seeing their family more often, and is also on the list for waiver support. So that is all I had today. That was high level, and then value-added benefits is next.
All right, good afternoon, everyone. Can you all hear me okay? All right, I want to make sure I'm not too loud. So my name is Chastity Harvey. I am the manager over our member engagement department, and I will be going over value-added benefits. I'm going to keep my presentation real light, and we are going to kind of cruise through the presentation because we are limited with time. All right, what is value-added benefits? Value-added benefits are additional services, programs, or features provided by the health plan or healthcare providers that enhance the overall value of the health care for members beyond the standard medical coverage. These benefits aim to improve patient outcomes, enhance member satisfaction, and to promote the overall well-being for the member. Value-added benefits are designed to create a more comprehensive and supportive healthcare experience for members, ultimately contributing to better health outcomes and also to higher member satisfaction. I'm going to briefly go over some of the value-added benefits that we offer here at CareSource. I will not be going over all of these that are on the slide because I know you all can read the slides. So I'm going to keep it nice and sweet and to the point. Some of our dental, vision, and pharmacy value-added benefits are as follows. We do offer extra adult dental benefits for our adult members. We also offer extra child dental benefits for our children, and we also offer a cute little smile pack for our children. As it relates to our Healthy Adults programs, We also offer a rewards program where we actually give out gift cards and various other items in the amount of $360 that our members can actually gain just by going to the doctor and receiving certain health checks. For healthy moms and babies, we have our rewards program for prenatal, postpartum, and well visits. Because we do realize that prenatal and postpartum care is important for our members, and we really want to encourage those members to receive all the screenings, we really want to reward them by providing them with $325 of extra benefits that they can receive. We also support breastfeeding, so we offer a free breast pump for those mothers that may be interested in breastfeeding. And then we also offer a new baby welcome kit. Under our Healthy and Active Kids, we offer the free YMCA membership at participating YMCAs. We offer the free Boys and Girls Club membership, again, at participating Boys and Girls Clubs, and also free Girl Scouts membership. Because we really focus on the health of our members and we want to ensure that those members that have been diagnosed with asthma, we want to make sure that they're getting their health checks and what have you. We do offer them free bedding. For free help and benefits, we have what we call a CareSource Day. And for our CareSource days, we do try to encourage our members to receive their well visits and to undergo other wellness activities at those events. And by doing so, we do provide them with a $25 gift card. As stated earlier in the presentation, we offer life services, and we also offer free rides to our members to go to doctor's appointments, to go to pick up their prescriptions, to go to job fairs, and also to participate in interviews. Because we like to operate from a level of transparency, what we also have here is we kind of rank some of our high-performing value-added benefits just based off of the utilization that our members have participated in thus far year-to-date. And some of our high utilization value-added benefits are as follows, with our extra dental child visits being our number one under dental, vision, and pharmacy. Number two is coming in at vision, and then our extra dental benefits for our adults. We also allow our members to participate in going to various stores located throughout the state of Georgia to utilize their reward dollars. And what we found is that our members actually love Walmart. And they love Walmart because they can not only go get food, but they can go get household items and other things. Our members also love TJ Maxx. And of course, who doesn't love Domino's? For our healthy moms and babies, what we found is that, again, because we really like to focus on our prenatal and postpartum care, what we found is that our number one driver in this area is our new baby welcome kits. I would like for everybody to know that we do offer a cute little onesie to our members, and our members seem to really love our CareSource onesies. And as I stated before, we have the free breast pumps, and we also offer sports physicals. Activities and up under activities and healthy adults, we all know that a lot of our members really utilize the YMCA not only for physical activity, but also as childcare for some of our members, because unfortunately, with the cost of child care, a lot of our members just can't afford child care, so they in return, utilize the YMCA. So what we found is that the YMCA is a high driver for our members. They love the YMCA. Then next we have our Girl Scouts, and then we offer Fitness on Demand, which is a fitness app, kind of like your Peloton app, where members are allowed to do fitness activities right there in the comfort of their own homes. For free help and benefits, our members absolutely loves the Life Services program because they are able to have that one-on-one coaching from our life coaches. A lot of our members do enjoy the fact that they can receive transportation and rides to pick up prescriptions, to doctor's appointments, and what have you. And then they absolutely love our Job Connect program. We all know that right now that employment is a big factor for a lot of our members, so we really try to connect them with community resources that will possibly help them to become employed. And then CareSource considers the following when we are selecting our value-added benefits. We are really big on receiving member feedback. We really feel like, how can we be an amazing company if we don't receive positive and both negative feedback from our members? So we really focus on receiving member feedback, and they actually help us to drive some of our value-added benefits. And then we are also really big on receiving that feedback from our providers. We know that in order for us to be an amazing health plan, that it takes an awesome partnership, and we try to make sure that our providers have input on some of our value-added benefits, and because they touch the members firsthand, they're able to tell us what they think some of our members can actually benefit from. We look closely at the overall health of our population. We work closely with our CareSource teams, and then we assess which value-added benefits are utilized throughout the year and which value-added benefits we feel that we have not received a high ROI on. And then for those value-added benefits, we assess, and then we kind of tweak our value-added benefits accordingly. We utilize the following to track our value-added benefits. We have an outside vendor that provides us with monthly and quarterly reports. We pull claim data that really does drill down and show us which value-added benefits our members are actually using. And then we use internal data. How can CareSource utilize member feedback and surveys when determining value-added benefits? We have what we call a member advisory council, and once a quarter, we bring our members to what we call the Purple Table Talk. And at that meeting, we sit around and we talk about various value-added benefits. We have discussions with our members about how we can improve as a health plan, and we also have deep discussions about diseases and other benefits that CareSource has to offer. We also look at our CAP survey, which is our member survey that goes out once a year. We really drill down into that member survey to really look and see what is it that our members are saying, what is it that our members are needing, and how can we continue to try to be the best health plan that we can be in order to meet our health outcomes. And then last but not least, we try to have what we call is our purple QR code at many of our community events. And that QR code allows our members to utilize their digital device, and they're able to go ahead and provide us hands-on, in-time feedback on things in which that we can improve upon at community events. How CareSource utilizes feedback. Again, we are continuing to receive that feedback and utilizing all platforms that we have at CareSource. So we utilize what we call is our My Life app. Our My Life app is our actual CareSource app that's just for our members. Members are able to provide us with real-time feedback utilizing the app. Members are also able to provide us with feedback utilizing the member website. And then last but not least, we have what we call is circle groups. And with our circle groups, what we do is we bring members together virtually. And again, it's just another way for us to have honest dialogue with our members about our value-added benefits, what they would like to see, what they feel would be a good benefit for us, and what are some things that they feel like we need to tweak. I am going to turn this amazing presentation over to Mr. Dwayne Flowers, Miss Rochelle Simpson, and they will be talking about the One Big Beautiful Bill.
Good afternoon. My name is Rochelle Simmons. I'm the Plan Compliance Officer for CareSource, Georgia. And again, I'm going to talk at a high level about the One Big Beautiful Bill. We call it the OBB, OBBA, however you want to refer to it. But this bill was enacted in legislation on July 4th of this year, and it includes several provisions that impact Medicaid managed care. Oh, thank you. The first provision I'm going to talk about is Medicaid eligibility. So this as a work or community engagement requirement for certain adults aged 19 through 64, where they have to demonstrate 80 hours per month of a qualifying activity. The one caveat here is that members with certain disabilities can request an exemption from this requirement with the appropriate documentation. The second one is going to be our Medicaid redeterminations. This is specific to our Georgia Pathways members, but this is going to require more frequent eligibility redeterminations and verification of income, employment, and residency. And that's going to change from being done annually to every 6 months. And then finally, our retroactive coverage. This reduces the retroactive eligibility from 90 to 30 days for Georgia Pathways, but for low-income Medicaid, that reduction is 60 days. Some of the impacts to the care management organizations for the Medicaid eligibility, there could be potential gaps in care continuity, increased member churn. For the Medicaid redeterminations, again, that impact could lead to increased coverage gaps. And then from a retroactive coverage perspective, that impact could be reductions in the capitation adjustments. From a provider perspective, that could essentially mean that depending on when a member was serviced and when that coverage was dated to, that could result in a reduction in claims payment. Let's see, and that is everything for the OBBB bill. I'm going to turn it over now to Shalonda. Oh, Lord, I'm messing up everything today. I'm sorry. What did I do here? Okay, there we go.
Audio and visual.
All right, good afternoon, everyone. Shalonda Agee, VP of Network, CareSource. So first, before we dive in, I'm here today to speak with you about rural health transformation. And I want to first start off with expressing great and deep gratitude from CareSource to the state of Georgia for prioritizing rural health transformation. It is so very important. By show of hands, who here sits or lives in a county that is rural? Show of hands. Excellent. So there should be significant connectivity between what I'm sharing with you today on this topic. So again, great honor to be able to partner with the state of Georgia and with DCH specifically on improving access in rural communities. So first, we've got 3 goals here. So first, it's to identify and address care gaps in rural communities. Second, identify and/or improve access to healthcare services. And number 3, to foster collaboration among stakeholders. And I'm going to underscore that because that is so essentially important. The answer and the solution does not sit in one entity. We all have to hook and link elbows together to drive solutions and deliver solutions to the community. So I want to emphasize that. All right, so first we're going to go to the overarching picture on health conditions that are prominent and prevalent in the state of Georgia. There are 9 that I'm calling out here. You can eyeball those as you scan through this slide. But what I want to also call out, we obviously see that there is maternal, there are a number of health states that are noted here, but also mental health is also identified as a chronic disease burden in the state of Georgia. Now, this is a really, I believe, an insightful slide that shares for you from a CMO standpoint. While we recognize that there are health state challenges, we also recognize that there are delivery of care challenges. So that we do not, in the state of Georgia, there are many healthcare deserts where we simply don't have particular provider types available in a given county. So what you see on this slide, I think, is very eye-opening. So you can see the region that's called out there. Then you also see the provider type. These are areas where we have limited access. And then you see the corresponding counties. So what I think is very important to observe is that you see in that second column, simple, what we take for granted perhaps in urban areas, having a 24-hour pharmacy. In many communities, that is not available. At the very top here, even in metro Atlanta, there is a shortage of psychiatric residential treatment facilities. I won't read through them all, but I am going to draw your attention to the Southwest. So you can see how those rows went from very thin to larger and larger and larger. So in the Southwest, we've got significant shortages. 24-hour pharmacy, allergy and immunology at the pediatric level as well, dental subspecialties, basic dermatology in addition to pediatric dermatology. The list goes on. So I want to highlight that so that you know that we know that there are deficiencies, there are opportunities for us to work together within those rural communities and with the Department of Community Health to improve the access throughout the state of Georgia. So very insightful slide in my view, and I hope you share that same opinion. Now, how do we address those gaps? Essentially, it's through network contracting, but here is the thing. While I oversee contracting, if there is no available provider in those communities that's offering those services, then there is no one to contract with. But it starts there. The important thing here is that CareSource regularly scrubs I'll call them data analytics that identifies new providers that are entering communities that may be available to fill these care gaps. So we're regularly working to identify, are there new providers in these counties that on the prior slide that have now recently entered a community that we could bring into our network to be available to provide care. So network contracting is 1, value-based incentives is 2. And that, I think everyone probably understands value-based incentives, but it's basically an incentive to promote and improve the healthcare outcomes. And they're typically financial incentives. Community investment, I'm gonna double click on that one. That is so important. So at the top of my speak today, I talked about how we've got to collaborate with community partners and stakeholders. That's where the magic happens. And then also continuous monitoring and accountability. The piece that I'll call out on this slide, while all of this is very effective, it's hard work, but I want to call out the community investment component. So I'm a huge believer in kind of walk the walk, talk the talk, and CareSource walks that walk. I have 2 examples I want to share with you that are recent These are not one-offs. This is a culture. This is part of CareSource DNA where we do this every day. But there are two recent examples I want to share. One is we recently planted a seed with the Farm Bureau of Georgia, where we recognize that even in our farm communities, there are disparities. And so we're partnered with them to ensure that they have the ability to continue to farm, to continue to lead healthy lives, to continue to support their families so that they too can provide and obtain healthy obtain health care. That's one. That's a $100,000 donation. That was just recent, about a month or 4 to 6 weeks ago. Second example that's really important. Anyone from Tifton or around Tifton? Oh, excellent. Big up there. Oh, over here as well. So yes, so recently we also partnered with the Volunteers of America, a $1 million partnership to support the development of an affordable senior community housing in Tifton. There was a ribbon cutting approximately 8 weeks ago. We are super proud to be a part of the solution in Tifton. And it's important to understand, and if any of you are asking the question on, well, that doesn't have to do with anything with healthcare, but it does. Research and studies show that when you can obtain affordable and quality health care, there's a direct correlation to your improvement of physical and mental health. And I think we all can relate to that. When you know you've got a comfortable roof over your head that's safe, it makes life a lot easier. So we are very proud to be a part of building the community of Tifton and those surrounding communities. So I just wanted to call that out, that the proof is in the pudding. CareSource, it shows the fruit of our commitment. Now I'm going to wrap that up, and essentially this slide speaks to 4 foundational mechanisms that we deploy to support the continuous improvement of rural health transformation. Number 1 in the upper left quadrant is enhancing healthcare delivery. How do we do that? There's telehealth solutions that we're constantly seeking to deploy and bring into network to expand access of care points. Increasing the number of mobile health units. If any of you have some mobile health units and where we're not working together today, we want to know about you so that we can partner with you. I'm going to move over to the right on the next box to the right, building trust and awareness, hosting health fairs, excellent partnership opportunities, utilizing local media, social media, dropping to the bottom left, transportation solutions. Again, another piece. So that first slide that I had spoke to of the chronic conditions, it goes beyond medical and mental. Transportation disparities also exist. So it's important there. And then finally, sort of the rinse and repeat, monitoring, evaluating the effectiveness of the solutions that we're driving in these communities. So I want to thank you for allowing us to partner with you and with the state of Georgia. This, again, is part of the fabric of CareSource. We look forward to supporting and linking elbows with you. We're in this together. So we close out our discussion today with just a contact us overview. You can see the information there. And I want to call out that if you have not had an opportunity to grab a health partner assignments like your provider relations representatives and what geographies they're assigned to, this is listed here on screen, but there is a flyer that's at our booth as well. So please feel free, if you have not grabbed it, please do. If you rather have it electronically, we're happy to share it electronically. So that wraps up our discussion with the group today. Thank you so much for staying and throughout, the day. It's been a long day, so thank you. And now we will open up for Q&A.
Did anyone have any questions?
Thank you so much for your presentation. We are interested with the mental health sector, with the autism spectrum. We already provide us with IDD, and we're also nurses in the community, RNs. So who do we talk with?
So I'm going to queue up Allison, but myself also can help.
Yes, yes, we want to become providers in your to help with the rural areas. We're already in the Atlanta areas, but we're looking to expand. So we want to be able to help in some of the rural areas, but we are more. It's a sister company of 4 nurses around, but we are more in nursing. With, yes, nurse practitioner and nurse practitioner. We are more into nursing and psych, so we want to do what we know how to do best.
I understand you, and thank you for your question. So the question that this wonderful lady has is around participating in CareSource's network for ABA services. Are you, you mentioned expanding. Are you currently in network and you're expanding practices, or you are currently out of network?
I must be honest with you. When we signed up with DCH, I know CMO came on board. I have to go to GAMES to see where we are, and I know CMO was, they talked about it a couple of years ago as we're moving along. But given the fact that we've been so busy with the other waivers, we really haven't dived into, because we kept asking, when is it coming? But me listening to CareSource, AmeriGroup, and the other one today,
Yes.
I think we're getting close.
Gotcha.
So we want to start walking towards that direction.
I see. CareSource's ABA network is currently closed. So we are not accepting new participating providers into the ABA portion of our network. That is also true for DME as well as laboratory. So that is true for Medicaid. However, there is opportunity for us to work with you for other products that we lead in Georgia, such as DSNP or Marketplace or TRICARE.
Okay, that works.
Thank you. I would love to connect with you after so we can talk about next steps. Oh, wonderful.
And good afternoon. My question today is CareSource still not going to require pre-authorization for outpatient mental health services?
That's a bit of a broad question, and I would love to get, can you all hear me?
Yeah.
Is that better? Okay, sorry about that. So when you say outpatient behavioral health, that can encompass a lot of different codes. Is there one in particular, or if not, I'll follow up with you directly after, because it may be a nuanced conversation.
Okay, I can follow up.
Okay, the answer, the high-level answer is that we require prior authorization on some and some on others, and it just really depends. And I can give you the background on that and refer you where to look on our website. Okay?
Any other questions?
Good afternoon.
Good afternoon.
You just spoke about CareSource being closed to the DMEs as well. I am a DME. Why wasn't I told that before I got credentialed?
And your credentialing started through GAMES?
Yes.
Okay, so you know when you go through GAMES, you are establishing credentialing status for all CMOs.
Right.
And so then from there, you continue that process to actually formally contract with that CMO. So that front end process for GAMES is for all. And then when you reach when you identify or have made a selection to, or choice to join CareSource, then we would notify you at that point of contact.
I don't think it happened like that.
However, I will, and so my question is, have you already, so I'm saying it's closed for new. Are you already in, or are you recently established
No.
as a Medicaid provider?
I'm only Medicaid, traditional Medicaid, only.
Yeah, yeah. So if you're not in network today, that network is closed for Medicaid. But it is open for Marketplace, DSNP, and TRICARE.
You have a question, Junior? Thank you.
Any other questions?
No, I was just following up with the question she asked.
About DME, why she wasn't notified that.
Exactly, because like I said, that pertains to what I said that 2 years ago, I think it's a little like last year ago, we've been asking, us that are already, we did the credentialing, like she said. for the CMOs. And we've been asking, what is the next step? I think me and her will find ourselves in the same situation.
Well, let me say this. Right now with DME and some of the ABA providers, our market is saturated. We have well over enough to meet adequacy. That doesn't mean in the future that we probably will open up our network to meet capacity, but right now we're fine. But we do have other products, and you're more than welcome to participate in our other product. We have a marketplace like Obamacare. We have a DSNP, and then something that's new on our plate is TRICARE. So you still have an opportunity to participate in our network. And in the future, once we have a need to increase our capacity, we can evaluate your request and hopefully bring you into the network. All right, any other questions?
I have a question for durable medical equipment. I know this, and that you kind of answered just the last person, but when it comes to a specific kind of supplies, if you're seeing a huge influx of, let's just say like caseworkers, in-network physicians with CareSource, sending referrals for specific kind of supplies. And the network is closed. Is there any way to obtain a prior authorization for member access or something to that nature?
Yeah, even when, our network is closed just for certain specialty, other specialties, it's open. And if there's a medical need for one of our members, if you're providing ongoing care, continuity of care, yes, you can contact our care management or utilization management team to get authorization. If they authorize the services, then you're covered.
Okay. What if you're running into the issue of the prior authorization denying, stating that there's one in-network provider to provide those supplies?
Okay, I fully didn't get that question.
I'm sorry. What if you are running into the issue of the prior authorizations denying, stating that there's one, is there a sole source provider for durable medical equipment, or?
No, there's not a sole source. I mean, typically, just in the healthcare industry, I've been in Georgia. I worked for a CMO for over 20 years. Sometime, CMOs will go with a one source. We had one years ago in my former life. But right now, from a CareSource perspective, we have many DME providers, more than enough to take care of our population. And the thing is, to be understanding our fiduciary responsibility to the state of Georgia and DCH, we have to properly manage those funds for the residents of Georgia. And so the only way we can do that is make sure we have an adequate network, a high-performing network, and sometimes we do have to close it when we're saturated. But it doesn't mean it's closed for forever. If there's a need in your area, we'll probably make contact with you. I will advise you to still go through the process to join the network. And, if we have the option to allow you in, we'll notify you. But for right now, it is closed. We have well enough physicians, DME providers.
Yes, sir. Thank you.
Thank you. Okay. We're going to take one more question.
Right here.
Where?
So I just want to make sure that you're clear when I say that I became a DME supplier, and I can't bill Peach State, CareSource, or AmeriGroup. They're closed to me. Why didn't somebody tell me that before I got credentialed? I would have chosen another route. I'm sure you guys already knew that.
Yeah. Well, we'll have Shalonda speak to you. And so she's coming down. But typically, let me tell you how the process works. When you enroll into Georgia Medicaid, that's for fee-for-service, okay? Because there's still a fee-for-service population that you have to service.
That's the only population I can serve now.
Oh, okay, I got it. But as far as their care management organization, most of us have been around for years, and and we are getting inundated with a lot of requests, and we just can't service our network because there's just too many providers in certain areas. But it doesn't mean we can look at your case and see if there's an option to reverse our decision. And our VP of network is going to come to you and get your information.
Thank you.
Okay? All right, any more? All right, guys. Thanks for coming out. We appreciate it.